Hello, this is Mark LaBarbera. Today I'm going to be talking about ways to remember medications and medication classes. This will be part of one of two. I intend to do the part two at some point later on, hopefully soon. So we'll start off with cephalosporins and penicillins, and I'm going to kind of group both these together. They're both antibiotics. Cephalosporin usually starts with CEF or CEPH. This ceph beginning reminds me of head or cephalic or encephalopathy. There's a 5% cross sensitivity with penicillin, so if you have a patient that's on cephalosporin that has a penicillin allergy, it's something to watch out for. On the bottom of the page, penicillins, another antibiotic, ends with cillin. Penicillin has I noticed that it has a lot of eyes in it, and the small eyes look like kind of tiny people standing there with little round heads. Penicillin was developed originally from mold, so it shouldn't be surprising that there's a lot of allergies to penicillin because a lot of people have allergies to mold. Okay, here's where they're also grouped together. So cephalosporin, cephalic, head, and on the right side you see penicillins, and you have cillin with these little people drawn in with the heads. And I've also drawn in little GI systems in these people because cephalosporins and penicillins are antibiotics. They are meant to kill off bacteria. You have a lot of bacteria in your gut. So when you take these medications, they kill off a lot of the good bacteria in your gut and cause problems, and you get a lot of GI upset and GI symptoms with them. Aminoglycosides or macrolides end with myosin. If you think the myosin mouse with the kidney body and the ear on top, remember that they're renal and ototoxic. Cyclins, doxycycline, minocycline, these have a couple things to watch out for. One is they cause tooth enamel discoloration. So you don't want to give these to pregnant women or young children because it'll permanently discolor their teeth. They also interfere with oral contraception. So if you think of your teeth, if you're a pregnant woman or a child, they may make your teeth unsightly. And if you're taking oral contraceptives, you have to watch your cycle. DDP4 inhibitors end in gliptin are for diabetes. Januvia is one. Glavas is one. When I think of gliptin, I think of G-Lipton, like Lipton diet iced tea for diabetes, for diabetics. So on the right here you see Wilford Brimley enjoying his Lipton diet iced tea. But if he drinks it too fast, he'll aspirate and then get pneumonia. One of the problems with the DDP4 inhibitors is that you have to watch for pneumonia with these. Oxycin or fluoroquinolones, antibiotics like ciprofloxacin or levofloxacin, and the oxycin reminds me of OxyClean. So using OxyClean in your face and whitening fluoride toothpaste will lighten your skin, but you'll sunburn easily. The fluoroquinolones will cause photosensitivity. Monoclonal antibodies, MABs, are targeted immunotherapy. So if you break down MAB, it stands for monoclonal antibody. These medications are injected and they cause flu-like symptoms. Because this is targeted immunotherapy, this medication goes in, binds up with whatever disease process it's targeted specifically for, and causes your body's immune system to go after that particular disease. And this has been used on cancers, autoimmune diseases, rheumatoid arthritis, Crohn's disease, ulcerative colitis, and even Alzheimer's. So because it's using your immune system and it's targeting these things, it's not surprising that you get flu-like symptoms as your immune system's ramping up. The pines or pines, calcium channel blockers. On the right, you see the upside down calcium channel blocker pine pushing down the blood pressure and heart rate. So these pines include amlodipine and nifedipine, among others. So these are going to bring down your heart rate, and along with the heart rate, your blood pressure will drop. So you have to watch vitals before you give these medications. Watch your patients as they're getting up so they don't become hypotensive and fall down. ACE inhibitors sometimes end with pril, and ACE is part of the renin-angiotensin-aldosterone system to control blood pressure. And so on the right down here, it gives a part of that diagram. The ACE coming from the lungs converts angiotensin 1 into angiotensin 2. Now, if we take away this reaction from the lungs releasing this ACE inhibitor, or this ACE enzyme, we stop this process and you don't get this high blood pressure. But because we're messing with the lungs, this also causes a cough. So you have this guy kind of giving this kind of dry prill cough. So maybe a way of remembering that you're acting on the lungs and your side effect is a cough. Beta blockers. I think a lot of people know this one already. Beta blockers often end in OLOL, metoprolol, propranolol. If you turn the OLOL around to kind of a mirror image, you have LOLO, like low, LOL. So that's a good way of remembering beta blockers. These will, of course, decrease your pulse rate, and decreasing your pulse rate, you're also going to decrease your blood pressure. So just like the calcium channel blockers, the beta blockers are going to do that too. Also, beta blockers will interfere with the pancreas, so it may not release insulin. So you have to kind of watch your diabetics as well, or watch for high blood sugars with this. Beta agonists. Beta agonists like albuterol and metoprolol end in OL, not to be confused with OLOL. Albuterol is a member of the methylxanthine group, which is the same group that caffeine is associated with. So these albuterol and metoprolol give you a lot of the same side effects as caffeine. Over on the right here, you see a coffee mug, and it has the OL built into it. And the coffee mug's shaking, and the blood pressure's going up, and the pulse is going up, and you get kind of jittery. So maybe you can use, if you're in a pinch, you can use coffee for your asthma. Although I wouldn't recommend it, but it would taste good maybe. We'll get to the next slide here. Okay. Diuretics, the thiazide diuretics. Not surprisingly, end with thiazide. So this is its whole class, its name. Hydrochlorothiazide and polythiazide. Watch for weight loss and electrolyte imbalance. If you add an ACE inhibitor, because of how these thyroid diuretics work, it'll actually prevent potassium loss, where normally if you just gave the thiazide diuretic, you would get potassium loss like you would with Lasix. So on the right are things that go high: hyperglycemia, hyperlipidemia, hyperuremia, hypercalcemia, and then down below they have hyponatremia, hypomag, hypo-K if you don't use the ACE inhibitor with it, and hypocalciuria. So your body hangs on to calcium, so you're not getting any at all out in your urine. Hyperglycemia, watch out with your diabetics. Hyperlipidemia, if they already have hyperlipidemia, this is going to make it worse. And uh, hyperuricemia, if they have gout, this may cause problems for them. That's the end. There are a couple other medications on this first page of this list, which I couldn't come up with any good memory tricks for, so I didn't add them in. But if you'd like to continue on with my work, you're welcome to do so. Again, as always, share this with people um, and give me feedback on it. Thanks for watching.